All you got to do is go to cadavers, scroll down until you get to the eyeball. And then when you get to the eyeball, just double click it. And then obviously that'll pull this up. I had to go back here to the eye here and add all these other systems in order to see that. We're going to start off by getting rid of the skin of the eye. And when we do that, we're going to see this big thing known as the orbital septum that's covering over the actual eye itself. This structure here is not on our list, so we don't really have to worry about it. I'm just going to remove it. When we do that, we're going to reveal the superior tarsal plate, also just known as the superior tarsus. And then we're going to see this here as the inferior tarsal plate, or again, just the inferior tarsus. Either one of those names are fine. So let's just put a 1 there. There's the superior tarsal plate. Here's the inferior tarsal plate. If we look at the superior tarsal plate, we're going to see that there's a structure coming from the orbit of the eye that connects into it. That is the levator palpebrae superioris muscle. Now, on the anatomized table, it's kind of hard to tell where it turns into the tendon and where's the muscle. The muscle is really back here in the actual orbit itself, and we'll remove that bone later just to see it. But for me, on test day, I don't mind if you just put levator palpebrae superioris wherever I tag it, okay? The tendon is listed on our structure list, but again, it's okay, I don't mind. Now, if we look at the superior and inferior tarsal plate, we're gonna see that they're anchored to the bones that we have here, the maxillary bone and the zygomatic bone by these ligaments. You have your lateral palpebral ligament, and then we're going to see another one here, which is our medial palpebral ligament. So again, we can just put pins there. Here's our lateral, and then here's our medial. And of course, medial is easy to identify because it gets close to where the nose is, versus this is where the zygomatic bone is. Now, if we turn the eye up just a little bit, we're going to see there's a gland right through here in the superior lateral portion of the eye. This is our lacrimal gland. We'll give it a little bit of color just to make it pop out a little bit. We okay so far? Superior inferior tarsal plate, medial lateral palpebral ligament, levator palpebrae superioris muscle, and then of course, lacrimal gland. Good to go? Let's remove the superior and inferior tarsal plates. Let's remove these ligaments. Okay, let's go ahead and, I guess we'll leave maybe the muscle in place for we'll leave it in place for the moment. And now let's look a little bit deeper in the eye. What we see here on the medial part of the eye is something that looks a little bit like a crab claw to me right here. This guy right through there is our lacrimal caniculi. If you remember back to osteology, we said, can I lick your eye? This is the canals that essentially are receiving the tears as they wash across our eye. There's a superior lacrimal caniculi and an inferior, but our list just says lacrimal caniculi, so that's all we care about. Now, the lacrimal caniculi are going to drain into this lacrimal sac. The lacrimal sac is right there. We'll give it a little bit of color just to make it pop a little bit more, but remember, we won't do that on test day. Or at least I don't do that on test day. We're going to remove the maxillary bone. When we remove the maxillary bone, we can now see the nasolacrimal duct. Okay? The nasolacrimal duct is what's going to carry the tears underneath the inferior nasal concha to drain into the nasal cavity. We okay with the lacrimal caniculi? It's the crab claw. We got the sac. We got the duct. Okay. Let's go ahead and remove those structures from here just to keep them out of the way. We're going to remove this fatty structure that's surrounding and protecting the eye. It's just this stuff right there, which is the extraocular fat. It just helps protect the eye. We're going to go ahead, I think, and maybe go ahead and remove this part of the frontal bone right here so we can see inside the orbit. Now, when we look inside the orbit and we turn the eye down, we're looking from sort of a bird's eye view inside the orbital cavity. We're going to see that there's some muscles that are connecting into the eye. Now, where do they connect? They connect to the white of the eye, which is known as the sclera. Okay? So the white of our eye is known as the sclera. And we're going to see that the sclera, if we turn it to the side, is actually continuous with this little bulge right through here. It almost looks like a little transparent force field known as the cornea. Okay? So the cornea is going to be continuous with the sclera of the eye, and those both make up the fibrous part of the eyeball and essentially give the eyeball its shape. So sclera is the white part, the cornea is the outer portion, and we'll go back and we'll look at that a little bit more, but for now, let's go ahead and let's take a look at the eye muscles. Now, a number of the eye muscles are really easy to identify because they're just straight, and so we just call them superior and inferior rectus, and then we also have the medial and lateral rectus. So let's make sure we can see those. I'm going to get rid of the levator palpebrae superioris just for the moment. And now we can see all these muscles that are connecting into the eye. So we have the superior rectus, and of course, if you have a superior rectus underneath it, you're gonna have a inferior rectus. Those are gonna help our eyes look straight up or straight down. We're then gonna see on the side of the eye, we have a lateral rectus. And then medially, of course, we're gonna have the medial rectus. Now on the anatomage table, it's really easy to tell the difference between medial and lateral, because we literally can just use this feature right through here if you're testing with me, and you can just put the cadaver in the face up position like this, and then we know what's medial versus lateral. If you can't touch the table, that's okay. We can still tell the difference because here's the nasal cavity on this side, and then here's the cheekbone. Now, if we turn this down from the top and we look inside there, we're gonna see that there's a muscle inside the eye that makes a nice little angle. See this guy right through here? It does this and then comes back like that. That's gonna be the superior oblique muscle of the eye. Now, the superior oblique muscle of the eye is gonna pass through this small ligamentous ring right here, known as the trochlea. Now, the trochlea is going to be our landmark for where we see the supra and the infratrochlear nerves and artery. They're essentially named based on their location to that structure. Now, the superior oblique muscle, I'm going to remove the color real quick. Do you notice how it goes from this darkish red color to this white light color right through here? That's because it turns into a tendon as it goes through the trochlea. So when you're looking on Models Day and you're looking at just an eyeball, if you can see something that looks like just a long tendon connecting, then you know you're looking at the superior medial part of the eyeball. Does that make sense? So even without any of these other structures, if you can see this tendon right through there, you know it's the superior medial border of the eye. Now, if you have a superior oblique, what are you going to have on the bottom? The inferior oblique. Now, there's a big difference here with this muscle, and that is that it's essentially going to be muscle the entire way. The tendon is almost non-existent, and so if you look at the inferior oblique muscle, it's going to look like complete and total muscle all the way through and no shift to a tendon. So the inferior oblique muscle of the eye is going to be found inferior, obviously, on the bottom of the eye. But again, it also tells me that this is inferior lateral where I see it connect into the eye. So even without any other landmarks, we can tell the difference. We okay with these muscles that move our eye? Let's take a closer look at just the eyeball itself. We saw just a minute ago, we saw the cornea, right? We saw this guy right through there. That's the cornea. Just behind the cornea is what's known as the anterior chamber of the eye. So if we remove the cornea, and if you look at this right now, you can see it almost looks like there's two force fields or something, like there's an inner layer and then there's an outer layer. If you remove that outer layer, now it looks like there's just this one separation through here, and that itself is the anterior chamber of the eye. If we remove the anterior chamber of the eye, we can now clearly see the iris, which is the colored part of the eye. And then we can see just in the middle of it, our pupil. Now, underneath the sclera, if I remove that, we're going to see what's known as the vascular layer of the eye. Now, here's the thing on the anatomage table. We don't really see all the blood vessels that would be passing through it. Let's see if we can. Let's add in these blood vessels. And now we can see all these blood vessels passing through there. So one way to know that you're looking at the choroid plexus or the choroid layer of the eye, also sometimes called the choroid tunic, is that you'll see all these blood vessels going to the eye itself. The other thing is, do you notice how suddenly there's sort of a sunflower surrounding the iris? That sunflower is known as the ciliary body. That ciliary body is continuous with the choroid layer of the eye. We okay with that? If you can see the ciliary body, then you know you're looking at the choroid plexus or the choroid layer of the eye. Now, if we remove the pupil and we remove essentially the iris, we can then see this other structure in there known as the lens of the eye. The lens is pretty easy to identify because we're going to see all these ligaments attached to it. These ligaments of Zen essentially are pulling tension on the lens of the eye, or they're relaxing tension off the lens of the eye to change where light is hitting in the back of the eye on the retina. Now, in order to see inside the eye, what we're going to do is we're going to use our blue scalpel. We're going to use this tool to cut, and then we want to be able to slice so that we can see into the back of the eye, where the optic nerve is entering. I'm going to go ahead and remove maybe this inner layer too, so that we can see that maybe just a little better. Okay. Now, the back of the eye is where we're going to find the optic nerve. Okay, so we've got our optic nerve right there. The optic nerve is essentially the exit point for all the retinal nerves. Remember, inside the eye you have rods and you have cones. The rods detect black and white vision, the cones detect color vision. They are all found on what's known as the pigmented layer of the retina. When we look here at the retina, I don't know that you can really see anything on there, and so I don't typically test you on the retina. Not to say other teachers wouldn't, just saying that I don't typically do that because I don't think you can see much of a difference here. However, we can see that opening up into the back of the eye is where the optic nerve is. Now, that's also known as the optic disc, and it's where we see our central retinal artery and our central retinal vein enter into the eye. See that inside the optic nerve? See that artery that's inside there? That's the central retinal artery and central retinal vein, and they open up into that optic disc. So what might that look like on test day? On test day, I could put a pin back here with nothing telling you what I'm asking for, and we could say optic disc. If you had a little sticky note and it said name the artery, we would say central retinal artery because that's where it enters into the eye. If it said name the vein, you would say central retinal vein. It's the exact same location for all three of those. We okay with that? What if I didn't put anything and I pinned it right there? For me, I'm giving you the choice to choose which one you want to call it, okay? I may have been looking for something, but since I didn't specify and I asked it that is that location, then you can give me any of them. Now, if it's not on an artery or vein, you can't do that, okay? And then what are you gonna do? Raise your hand, ask me, and I'll give you clarity. Now, on the retina, there's gonna be another area just lateral to the optic disc known as the macula lutea. That's known as a yellow spot. That's literally the translation. We aren't gonna see that on the anatomage table, which means I can't test you on that for the anatomage table, okay? So again, the macula lutea is something I won't test you on. Are we okay with the eyeball itself and the things I would ask or wouldn't ask? I do wanna point one other thing out. In the eye, this is our lens right through there, right? And this was the iris. Well, this is the ciliary body, but the iris is in this same area. The posterior chamber of the eye is not this area back here. All this area back here, this is all where we see something called the vitreous body, okay? The posterior chamber of the eye is anterior to the lens, but it's posterior to your iris. That's the posterior chamber of the eye. The anterior chamber of the eye is anterior to the iris, but posterior to where we saw the retina. And through the pupil, we typically have that aqueous humor or that fluid passing between the pupil to the anterior and posterior chamber of the eye. It's kind of hard to get a pin back there, so I don't frequently tag that. But again, that's where it's located. Are we okay with that? Again, the posterior chamber is very small. Anterior chamber is a little bit bigger, a little bit easier to tag. Now, if we're keeping notes, we're getting to the point now where we need to see essentially the nerves of the eye, okay? So we're gonna go through and we're gonna uncheck the nerves and then recheck the nerves, and then that's gonna pull up all of our nerves for us. And we're gonna look from a top-down point of view. Okay, zoom out just a little bit. I want all of my extraocular eye muscles there because I'm gonna use those as a landmark. Okay. Now, if you remember initially what we said that we could see the levator palpebrae superioris muscle on the very top, and it sits on top of the superior rectus muscle. The nerve that you see on top of the levator palpebrae superioris is going to be your frontal nerve. Your frontal nerve is going to be a branch from your trigeminal nerve, specifically the ophthalmic division of the trigeminal nerve. To see its origin, I'm going to remove the sphenoid bone. We could also make it transparent, but I think it's just easier to see if we just remove it. Now, if you look, the ophthalmic division of your trigeminal nerve actually gives you a number of nerves. So one of the nerves it gives us is the frontal nerve. Another nerve it gives us goes to the lacrimal gland, so not surprisingly, it's known as the lacrimal nerve. Another nerve it's going to give us is known as the nasociliary nerve. Now, we technically already looked at this nerve before because it gives us the anterior and posterior ethmoidal nerves. So if we look, we can see there's one more nerve coming from there, and it's a little bit deeper, and that's it right through there. That's our nasociliary nerve. Now, in order to see that just a little bit better, I'm going to go ahead and I'm going to remove some of these extraocular eye muscles. Okay. Now, one thing that's going to help me find the nasociliary nerve beyond where it connects is this ball of tissue. See this ball of tissue right beside the optic nerve? That's known as the ciliary ganglion. Our nasociliary nerve is going to give a nerve that goes through the ciliary ganglion, and then it goes to the back of the eyeball. That's known as our short ciliary nerves. The nasociliary nerve gives us another nerve that goes to the back of the eyeball. We can see it right there. It doesn't go through the ciliary ganglia, so this is known as the long ciliary nerve. So one way you could find the nasociliary nerve is to essentially find these short and the long ciliary nerves and the one that's passing through the ganglion. That ganglion makes it a pretty easy landmark to be able to find the nasociliary nerve. Now, we don't see it on this cadaver, but don't forget, we get our posterior and our anterior ethmoidal nerves also come from the nasociliary nerve. Because remember, nasociliary, the nasal portion was the anterior and posterior ethmoidal nerves. And then the ciliary portion is the things that are going to the back of your eye. We okay with that? I'm going to put our muscles back on here because, again, we need these muscles as landmarks. The first landmark I want to do or use is going to be your superior oblique muscle. You may remember we said solar 3, solar 4, 46 3. The superior oblique muscle is innervated by the trochlear nerve. The lateral rectus is innervated by our abducens nerve, cranial nerve 6. And then every other eye muscle or everything else that moves your eye is innervated by the oculomotor nerve. We okay with that? So what does that mean? It means I can use the superior oblique to find the trochlear nerve, right? So if I look, I can see there's a nerve right here, and it goes into the superior oblique muscle. You touch it, you see it goes into the superior oblique muscle, so that has to be your trochlear nerve. If we turn this to the side, we can see that this is the lateral rectus. Now, we already saw that there's a nerve very close to the lateral rectus, but it doesn't actually penetrate the lateral rectus. You see that? It never goes into the lateral rectus. Instead, there's another nerve right there, and this one actually is seen going into the muscle. So I know that's got to be my abducens nerve. So our abducens nerve is going to be easy to find because it's literally going to pierce through the lateral rectus muscle. Any other muscle of the eye is going to be innervated by what nerve? Oculomotor nerve. That's right, oculomotor. Let's see if I can get it right there. Now, when the oculomotor nerve goes into the eye, it kind of does this little alligator shape, just like this. The one that goes up is superior oculomotor. The one that goes down is inferior oculomotor. The easiest way I can think to see it on the table is maybe to put this in anatomical position and then just kind of turn it to the side. And now you can clearly see like one's going up, one's going down. We okay with that, guy? Okay, let's minimize that just for a second. And let's pull up our other cadaver. Okay. And you may remember that we actually already saw these nerves here where they emerge. If you remember, we saw our supraorbital nerve here, and we saw our supratrochlear nerve. Those are the terminal branches of the frontal nerve. Here, we can't see it very well, so I'm just going to highlight it and give it a little color. That's the infratrochlear nerve. The nasociliary nerve actually exits or penetrates through the orbital septum and then innervates this area around the medial canthus of the eye and then goes down towards the nose just a little bit. And that's the terminal branch of your nasociliary nerve. Now, the only other thing that goes to your eye that we haven't seen is the ophthalmic artery. Let's see if we can find that. We're going to use our blue scalpel tool again. We're going to cut this guy in half. That's not very helpful, so we're going to use our little slider bar here and start building back on. And what I'm looking for is the orbit to pop back up. And there it went. There's the orbit. See that artery right through there? Let's get rid of some of the brain. Okay. See that artery right through there? That artery that's coming up through here is going to be a branch from our internal carotid artery. Okay? So again, the internal carotid artery goes through the carotid canal. And before it connects with the circle of Willis, it gives us our ophthalmic artery. So if we look down, I don't know how well we can see that right there. We get our ophthalmic artery. So again, the ophthalmic artery, and let's maybe ghost out the sphenoid bone so we can see that maybe just a little bit better. Okay, so now we can see it like coming right off of there. So there's your internal carotid artery right there, giving us the ophthalmic artery, which then goes into the orbit of the eye. Now, beyond that point, everything else we saw in the eye, those are all the same names that we're going to give the artery. So we saw our ciliary arteries, posterior ethmoidal, anterior ethmoidal, nasociliary, all of those other things that have arteries that travel with them, okay? So again, we've only got a few arteries that are actually on our list, but we do need to be able to identify this coming off the internal carotid artery. On test day, if I ask you that, I may clean it up a little bit more so that you can clearly see it's coming off the carotid artery. All you have to do is recognize if there's an artery going into the superior orbital fissure, it has to be the ophthalmic artery. Any questions about anything from that eye portion? Is there anything on your list that I didn't show you?
The conjunctiva?
Yeah, thank you for asking. The palpebral and the bulbar conjunctiva. If you take your eyelid and you flip it upside down, there'll be a shiny surface on the underside of your eyelid. That's known as the conjunctiva. We can't show you on the anatomage table either the pulbar or the palpebral conjunctiva. So both of those won't be on the anatomage day. On the models day, you can see the pink, the back part of the eyelid, and that's the location of the palpebral conjunctiva. On this one, we can't see it. Was there anything else on your list that I didn't mention? Because I know the second I hit the stop recording button, you're going to tell me. I got it? Okay.